Thank you so much, sir. I'm sorry I had to barge in between. I'll be talking about, slides are not moving. Yeah. So molecular diagnosis of retinoblastoma is available only in few centers, but another important aspect is sending the fresh specimens, which is the bottleneck now. So we aim to develop an indigenous method for the molecular diagnosis. So DNA is isolated from the blood and the tumor samples wherever it is available using the suitable kits. The quantity and the quality of the isolated DNA is checked by the qubit fluorometer and the agarose gel electrophoresis. Sanger sequencing and multiplex ligation dependent probe amplification were used to detect the point mutations and deletions, duplications of RB1 gene. Both the steps involve the amplification of the gene or the probe that binds to the gene. So we do methylation specific, that is MLPA, for detection of promoter methylation in RB1 gene. Next generation sequencing methods for the targeted, sometimes just or whole exome sequencing were also employed to detect the single nucleotide variations and copy number variants in additional genes. I'll be sharing details about it. So a fully functional setup has been made at Aravind Eye Hospital, Madurai, with 543 families who have been benefited by this. So with all of these methods and high throughput instruments in place, we could now complete the analysis starting from sample collection to report generation in just 3 weeks' time. The genetic analysis and counseling benefited 543 families with retinoblastoma. Patients with mutations were 305. Patients without mutations were 238. Families with mutations were about 41. So more than 100 mutations covering a diverse spectrum such as nonsense, missense, frameshift, splice, are identified by our analysis, out of which 20 are novel, and these mutations are being characterized for the pathogenic role. This is a patient where promoter methylation was identified actually in 4 patients in our cohort, but not in the blood. So if it's there in the tumor sample and not in the blood, this is an epigenetic event and they're less likely to inherit the mutation to the next generation. This is one such case where there was a unilateral RB without any family history was found to have the promoter methylated in both alleles. The red arrows show that. So increased copy number of MICIN was demonstrated in several cancers. In our cohort, we detected increased copy number in 3 patients correlating to the severity of the disease. Our next generation sequencing analysis has identified several candidate genes involved in the tumorigenesis. We found the gene amplifications of many of these which are mentioned, and these genes are involved in the cell cycle regulation, cell proliferation and apoptosis. Now this is one case where proband presented at 4 years with the bilateral RB. Mother right eye was enucleated earlier on. Subsequent follow-up for the patient who was undergoing treatment, mother was pregnant. So we had asked the mother to bring the child as soon as the child is born, that is the next sibling. So the 12-day-old sibling was brought to us to the clinic. It was identified with group B RB both eyes, and vision could be salvaged for these that sibling. Here we had 2 similar looking twins. One had RB and the other had a suspected RB. There's no family history of RB, so no mutation was found in the parent's blood. Twin A had de novo germline mutation in the blood, and the other twin did not have any mutation in the blood, which meant that the other child was absolutely normal. Proband presented at 36 months of age with no family history of RB, unilateral RB, group E. Germline mutation was identified in blood, which means that unilateral cases should also go for genetic analysis. Proband presented at 26 months of age, right eye group E. Germline mutation was identified and closely monitored. And the patient turned bilateral RB during the treatment period. Analysis of parents showed the father as an unaffected carrier, so predicted higher risk for the next sibling. Proband's wife was 2 months pregnant, had a familial RB with 4 affected members. Proband and the mother had heterozygous deletion of exons 3 to 13. Family wanted to know the risk of RB in the growing embryo. Prenatal testing was done by amniocentesis and the same deletion was found in the fetal DNA. So, risk of RB in the offspring. Left eye enucleation was done at 6 months for the patient. No mutation was found in the patient's blood, and so it was less than 1% chance of getting RB in her offspring. Followed up and a normal child was delivered. Risk of secondary tumors. Left eye was enucleated at age 2 years. No history of RB, non-consanguineous family history. No mutation identified in blood, so no risk of developing secondary tumor. So genetic analysis plays an important role in clinical management of retinoblastoma. Our translational research of genetic testing. It was affordable model, and our model can be replicated in a resource-limited setting. We have touched the lives of more than 500 families, 2,120 samples through genetic testing and counseling. Thank you very much.
Thank you, ma'am. So, which all patients of retinoblastoma do you advocate this blood testing, ma'am?
Yeah. So earlier on we never did the genetic testing. Since now we have the genetic testing facility available at our own center, we do it for all patients who have come with retinoblastoma.
And with family history of retinoblastoma.
Yes, and not only with family history. As I had pointed out, there are some cases where there's no family history of retinoblastoma.
Okay.
So we can categorize it as a germline mutation or a somatic condition. So when you have family history, it's easy, you know what is going to be the situation. But when you don't have, especially with the unilateral, which is we are teaching earlier on, in this case you had a mutation in the blood as well. So which means that it can be inherited for the offspring as well. So it is important. The emphasis here is all patients who have retinoblastoma, it's ideal to have a genetic testing done. That's the crux, which I'd like to emphasize. Thank you very much.